All right, I think we're good to go. So let's see here. So we got a handful of people on the call already. We'll just wait another couple minutes or so, and there, you know, since it's 90 degrees here in Michigan right now, I know it's pretty warm in most of the country. We're a lot of people are asking about what we could do now, what activities, and how to think about that. And if you've been joining these sessions since the start, and this is the 14th session that we've had, you'll know that there's pretty much themes on how we're going to be able to answer this stuff, and that there's no yes or no, right or wrong answer. There's no binary decision in how to answer these. And so I'll go through kind of my little spiel here, and then we'll take questions, specific comments that you may have that you could add to Facebook, and I'll be hopefully able to answer those. And so one thing that you're seeing now is a pretty significant drop in cases, especially hospitalizations, deaths, and cases. And like we've been saying from day one, that there's no escape from COVID. There's no escape from the virus. And we weren't sure what this was going to look like as far as the incidence rates, right? Whether we were going to see kind of the slow burn or what types of peaks that we're ultimately going to see. And it looks like what we're going to have is some seasonality in that we're likely going to have a drop in cases in the next month. That's what it looks like. But that is actually more concerning than if we didn't have a drop in cases. So that's paradoxical in a way, right? Because there's no way around this. The COVID, the respiratory, we're on COVID time. This is, as Michael Osterholm likes to say, this is like a COVID virus gravity, right? We can't escape the laws of gravity. We're not going to be able to escape the laws of this virus. And so what's very concerning is that as cases continue to decline and people's behaviors can change based on that decline, there's a greater likelihood of what we're going to see is a worse return of the virus at some point. When that is, we just don't know, but it will return. And it looks like more and more that this is following a closer trajectory of the 1918 influenza pandemic, where you had a peak in cases early on, and then it just almost disappears for a few months. And then what you see is a huge increase in cases. And it's that surge of cases that gets them closer to that kind of 60% infection rate. And then once you get that, you start tailing off again. And no vaccine a vaccine will unlikely be a savior over the next year. And so we're talking 18 months, right? 18 months, 1 to 2 years of dealing with this. And it's concerning that right? We want cases to drop, but remember, the whole idea of flattening the curve wasn't a reduction in cases. It was just the velocity of cases we needed to slow down. The area under the curve didn't change, meaning we're still going to get 70% infections, more or less, right? And we won't avoid that. So the next question always became, well, then how do we live with the virus? And that is what we are addressing right now and dealing with now. And here in the United States, because we really have confusing messages, poor leadership, and no central command here that's disseminating information, we're left with dealing with this on our own, state by state. And unfortunately, that ultimately is going to cause us problems again. Because what you're seeing now is as cases continue to decline, you don't need to be, right, there's not much that we need to actively be doing to manage this decline in cases. But now is exactly the time that we should be capitalizing on to prepare ourselves for what's to come. Because I promise you, not 100% certainty, but close to 100% certainty, that what we're going to see next is going to be probably at the level that we just saw, or even worse. Perhaps it's a little less and it's just continuous. But it's one thing when times are when the tide is in, or when the tide goes out, right? Like there's not much to fight with. But when that tide comes in, we're going to be wrestling with a lot of issues. And so hopefully we get our acts together a little more than this last surge of cases, and we can manage this a little better. So to come back to where we're at right now is going to be good times in the scheme of things. What I mean by that is cases are dropping, and that's really good. The weather is warm. People are doing basically some decent physical distancing and mask wearing. This is going to be the next probably month or two is going to be the best that we have in a while, is my guess. Again, these are projections. I can't tell you for sure what it's going to look like. So I wanted to get into a lot of, what we can and can't do, what's safe and unsafe. Like, for example, I think if you're a 30-year-old person who's otherwise healthy, at this stage, we probably don't need to be disinfecting things like your groceries, right? Like, I'm pretty confident we could move past that. If you're 70, 80 years old and you are high risk for whatever reason, I think you always need to maintain very high vigilance. That's a choice, right? It's a choice, but you're going to need to maintain really strict vigilance when you do this. So summer is around the corner. It's warm in many places, and this past weekend, 90 degrees here in Michigan. We had my son had a friend over. They made like a slip and slide. I'm fine with that, but I had to keep reminding them to maintain some distance apart. Now, I want to just bring up a concept that you could think about moving forward to educate yourself and to kind of implement as we go forward. So it's really important that you understand prevalence and incidence, because that plays a big role in how the virus will be transmitted personally and in your communities moving forward. So the prevalence is how many people are currently infected in a population at that given moment, okay, in time. So for example, my community here, let's say we only have 10 people infected. Out of 100, that would be a prevalence of 10%, okay? And that's very high, by the way. And so prevalence is important, right? So it's the whole idea of if you have a jar of 1,000 marbles and you have or let's just make it simple. If you have a jar of 100 marbles and you have a prevalence of 1%, right? And you have one blue marble and 99 red marbles, right? The probability of picking up a blue marble is pretty low with lower prevalence, right? As prevalence increases, let's say you have a prevalence of 50% and you have 50 red marbles and 50 blue marbles, the likelihood of picking up a blue marble is much, much higher, okay? So think about that as virus in your community. The prevalence, when you have low prevalence areas, so let me rephrase that. The same behavior in areas of different prevalence matters, okay? So for example, if I have 2 jars, right, and we think of the red, let me redo the colors, right? The red marbles are virus, the blue marbles are no virus of people. And if I have 2 jars, and one jar, they both have 100 marbles, and one jar has 1 red marble, and one jar has 20 red marbles, right? My same behavior in each of those jars, obviously, the jar that has 20 red marbles, I have a much greater chance of contracting or picking up a red marble and getting the virus, okay? So that's prevalence. Now, the other thing is incidence, and I wanna, because that's gonna be really important moving forward as well. Incidence is the new infections that are added to a community over time, okay? So think about this. If I had those same 2 jars, 100 marbles, I have 1 red jar in one, I have 1 red marble in one, I have 20 in the other, and the rest are blue, normal, and 100 total. If the incidence is increasing, meaning in each of those jars I'm adding 5 red marbles a day, okay? It doesn't really, obviously the ones with the higher prevalence become very dangerous, but then even the ones with the low prevalence could become dangerous as well, because the incidence is adding more and more infections, okay? So that is a really important point to think about, because right now what we're seeing is lower prevalence in our communities, and we're seeing a diminishing or a dropping incidence in our communities. And because of that, our behaviors, right, we have a lesser likelihood of being infected by the same behaviors that we had a month ago, okay? We have a lower likelihood of infection. But as we know this will change, the environment is going to change again, we need to understand that what behaviors we have today may not have the same result or outcome as in a higher prevalence and incidence environment. So hopefully you can wrap your mind around that, and I'm certainly able to answer specific questions about that. So, okay. The next thing I'll touch on is like what activities are, based on risk, right? Because there's never going to be zero risk in the things that we do. So I'm going to use kind of a risk scale, kind of a low, medium, and high. And I will give, kind of groupings, examples of these things. And then feel free, you could add to the comments specific activities that you're interested in, okay? But there's some rules of thumb, a rule of thumb here for lots of, that you could apply kind of across the board to some things that you're interested in, right? And all of this is really based on everything that we've been talking about. If you go back to episode 1 of these updates, right? We've been fortunate in that everything we've spoken about has been rather consistent with what's been happening. And the important kind of takeaway here is the fundamentals have remained strong in what we've been talking about here. So if we use the processes that go back to the very beginning, we could apply them now, right? We learned about the virus. We learned about how it transmits. We learned all about these things. And now what we do is we apply those principles to our behaviors. So, right, we could start with something very simple, inside versus outside, right? Anything you do inside will be higher risk than outside. So just keep that in mind. If you wanted to meet with someone, see a family member, go outside and see that person. That's what is, right? Use that as a first principle. Doing things with more people versus less people, right? The more people you introduce, the greater likelihood that someone is an asymptomatic carrier or a carrier. And so you want to choose lesser people. The duration of time together, right? Shorter duration versus longer duration. You're always going to want to choose the shorter duration activities associated with lower risks of transmission as well. So, just thinking about kind of those three principles, those are like first principles. You could start making decisions of your behaviors and activities. And so for people who are just joining now, I just want to reference you back to the beginning of this call as we lay down the foundation for some of the things that we're going to talk about. And also as a reminder, this is the 14th episode of our reviews here. And so if there's anything that some of these things are already based on a lot that we've spoken about. So I just want to put that out there here. You could go back and find all of our sessions on earlier Facebook, on my feed, or on YouTube as well. So start thinking about what activities, and feel free to put some in the Facebook comment section, and I could try and address those, each of those questions. Some of the things like flying on an airplane, certainly going to be higher risk activity. Getting a haircut, it's going to be a higher risk activity. How do you reduce that risk? You have a mask on, and the person cutting your mask has a mask on, okay? Lower risk activities, going to a pool, believe it or not, right? And staying 6 feet away from people. I think it's safe to be in the pool with people. I don't think that we're going to see transmission through water. This is a respiratory virus, and we're going to apply those same types of principles. So this is so I think jet skiing in a lake should be totally appropriate, right? You just want to reduce the number of people you're around, and you're in an open lake, you're totally fine to do that. How about a gym? This is a good one now. So let's say you have a small gym that you work out at, right? One-on-one with a trainer should be totally reasonable. I think if you want to make, ideally a trainer could get tested, or, and then that would be ideal. But without that, I think if a trainer wore a mask, that would be ideal if you're going to be within 6 feet of one another, okay? So less people, and I know in a gym you could potentially, in the summer especially, maybe open up the garage door or a window or something like that. That would work as well, okay? I would stay away from, let's say you have bigger gyms. Take like a large Powerhouse or whatever these Gold's gyms are. I think they went out of business, but let's say, being indoors is not as good as being outdoors, but fine. Let's say you're indoors, then you just want to maintain a distance, okay? 6 feet. And you also want to make sure that the equipment is clean between people. Things like the beach. I think the beach is going to be a pretty low to medium risk place, right? Being in the water is fine. You want to just really make sure you are 6 feet away from people. The one thing that I think could be dangerous is if you're laying on the beach, there's a couple or a family that's right next to you that you don't realize it, and potentially there could be transmission there. But you want to be cognizant, maintain your space, and everyone should be doing that right now. Renting an Airbnb, I think in itself, low risk, okay? You want to, so I just rented, I have an Airbnb that I'm probably going to be renting, staying in. And I told the owner, I was like, we need to make sure that that place is cleaned down before I go. And this is a respiratory virus. So I'm going to get there. I'm going to open up the windows, right? I'm not going to be licking the surfaces of anything and kind of let the place air out. But I don't think inherently I think it's a low to medium to low, a low, medium risk. I think, let's say, go into a public bathroom, let's say, or a bathroom at a restaurant. Now you're dealing with a medium to high risk there, okay? Especially bathrooms that are tight, right? So if you're at a urinal and you have to walk into a bathroom and for men, stand next to someone, that's what I would consider who's not wearing a mask and who's a foot away or 2 feet away. That's what I consider a medium to high risk, closer more to the high risk scenario here, okay? Anytime, and this is where prevalence becomes interesting, anytime you are around someone that you do not know whether they've been behaving in ways that are safe, then you increase your odds, right? You increase your risk. So let's see. We have okay. So those are a restaurant. So I still see a restaurant as being medium to high risk. All right, just because there's a lot of people in a closed space, and that's concerning. That's concerning for me. Okay, so anything else? Throw out. There's a question here. I'm going to read it in a minute on the Zoom, and I'll read one on. Let's see here. I have a Facebook question. Anthony from Jersey, you survived COVID. So wow, man, that's so I'm taking it that you were infected and you survived it, man. Congrats. That's I'm sad to hear you got it. I'm glad to hear you're doing better. That's really great. I would love to hear how you feel now. If you have any sequelae or consequences from it, are you more fatigued? Do you have any problem with breathing at all? Anything like that? That's one of the things that I really want to know and get more and more information about. So a question from Facebook feed is, what are some of the pre-existing medical conditions in which people have that still might put them at risk? Nothing's changed with the pre-existing conditions. Remember my statement from day one. There is no comorbidity that is protective of any ailment or disease out there. The less healthy you are, the greater risk you are for every condition, okay? So nothing's changed. High blood pressure, heart failure, diabetes, any autoimmune disease, these things are all concerning, are risk factors, right? And some may have more play than others, but it's just, right, the less healthy you are, meaning the less reserve that your organs have, the greater risk there is, okay? Oh, and at risk for complications, yeah. All right, let's see here. So another question, what about daycare and nursery school programs? Will young children be able to understand keeping face masks on? So I do not think that there is a way that we will be able to have kids schools, nursery, daycare. That's actually, so obviously we're looking very carefully at what's happening with the pediatric multi-system inflammatory disorder and any other complication that may arise. I think it's really important to keep tracking that. But kids overall, even with that condition, far and beyond are doing very well handling the issues of COVID. They're doing very well. So this is not really a question about kids as much as it's a question about kids being a vehicle of transmission to adults and older individuals. That's the issue here. And I do not have a good answer for you on that. It's going to be risk assessment of your personal situation. I still do not believe that young kids who may be asymptomatic carriers, who are, not strict in their COVID adherence of physical distancing, should be around high-risk individuals. That is going to last for 2 years. That's going to last for a very long time, I should say. I do not think that risk is necessary. Unless you could test. That changes everything. If you could test a young child day 1, maybe test them day 2, and then they could meet. Okay, just think about how testing changes things. All right. So Netra Desai, I need to travel with my kids from Southern California to Tampa. We will have to change planes. Should I think again about air travel? I think you need to decide on, so I'm thinking about air travel myself, and I would go on with masks. I would put masks on your kids. I would perhaps make sure you wash your hands, bring some sanitizer on the plane, and do your best there, And the real question I would have at this point is, when you go from point A to point B, who are you going to be around at point B? And to make sure that you're not around high-risk individuals until 2 weeks go by, and you could be assured that that 2 weeks go by, right? And then you no longer would be a vessel of transmission. I think the reality is, guys, and I've been saying this, right? We need to learn to live with COVID. If for every 10 people on this call, 7 of us are going to get infected. And the reality is, we need to delay that as long as possible, because treatments get better and perhaps there may be a vaccine. And so everyone wants to prolong when they're going to get infected. But right now, on this call right now, there'll be at least 3 people who will get infected if they're not already infected. I mean, that's close to 100% uncertainty. They're close to it, okay? And so those are the things that we need to be thinking about in those discussions. So Netra, I would say make sure you have masks. KN95 or N95 masks are the best. Make sure you know how to wear those masks. Make sure they are tight-fitting around your face. Not tight-fitting, but appropriately fitting, that there's no seal, that you keep it on the entire time, okay? And that you're not touching it, okay? You do those things, that's the best you could do. I may even, if I flew and I have extra masks, hopefully the airlines are implementing a mask a policy that everyone must wear a mask. I'm going to pack a few extra masks, and for anyone around me, I'm going to give them that mask. I'm just going to say, hey, here's a mask. Would you mind putting it on? We'll see how that goes. I'm sure there are some people who are just ideologically against it, which is crazy. Hopefully that helps with that question here. All right, let's see here. Josh Weiss, how do you feel about construction sites with everyone wearing masks, but 6 feet is nearly impossible to maintain? So again, right, this is just first principles. So if being outside is the best versus being is better than being inside. Being greater than 6 feet is better than not being greater than 6 feet. If you have to be closer than 6 feet, then wear masks. But I would take the time on training how to wear a mask, right? If you're going to give someone the mask, at least train them on how to use it. That is so critical, okay? And we do a training on our Facebook session on masks. So that's really important to do. Okay. My kid, Sarah Oliver, my kids' camp in Wisconsin is open. June only is open in June. One of only 2 in the state. I'm not sending my kids this summer. They are doing small groups that don't interact with other groups. Okay, yeah, I think that's a personal decision with camp. I'll tell you this, and if my son's camp has not been canceled, it's in Wisconsin. It's a sleepaway camp, and we right now, we don't know for sure, right? We're not faced with this decision just yet, but we are leaning towards sending our 9-year-old to a sleepaway camp, knowing that this sleepaway camp has communicated with us multiple times. And by the way, it's Camp Kawaga, multiple times on how they're going to deal with COVID-19 at their camp, what their policies are, what their processes are. They've laid this all out for us, and they've done a really wonderful job in doing so. And so I feel confident about what they've done. I feel confident in their response, and that they'll be able to handle this. And because of that, I think there's always risk. It's never zero. And it's a personal decision. Okay. So let's see here. Okay, so Netra, back to your question. Okay. Well, I wouldn't necessarily, Netra asked the question about flying. You haven't seen your parents in 2 years. Is there a way for you to stay in a different location, rent a hotel, an Airbnb, someone else's house potentially, and you get to see your parents with masks at a distance? That's worth something there. That's worth something. So maybe you could consider that. I'm happy to talk to you offline about that as well. So Carmen, okay, and then I know Perry Morgan has a couple questions on here that I'll get to on the Zoom. So let's see here, Carmen, Professor Guitre, could you say a bit more about the numbers of cases? You mentioned at the start that numbers are going down, but I thought that numbers were increasing in some places. Yes. What's the best source of information if we're trying to follow what's going on? Okay, so here's the deal. Numbers are, right, they're always going to be, when you look at the additive effect of numbers here as far as cases go, and I'm just going to pull up a graph from the Johns Hopkins, right? Numbers are always we're going to continue to increase numbers for a year, 2 years, even potentially longer than that, okay? We're going to see, when you look at it on a linear scale, you're going to go from, right, in the US, 1.6 million, and let me look at it logarithmically, 1.7, 1.6, we're going to keep adding numbers, okay? What we see in certain areas we're going to get hot spots. Alabama may be increasing, Georgia may be increasing, right? Those are these hot spots here. Overall, all right, as a nation, we're seeing cases slowly decline. The New York Times has, I think, let me just pull this up here. Okay. New cases across the world is starting to pick up. Deaths are declining, which is good. And if we look at the United States and across the world, what we're seeing is just South America now is getting ravaged. Yeah, and here in the United States, we're seeing a general downward trend, okay? And that will likely continue for a little until it doesn't, Okay, and I promise you, there will be there will be a change. Okay, um, but there's definitely, and velocity matters, right? The incidence really matters as well. And so what we're seeing is, because I know that cases are declining, the incidence is dropping, and that's impactful here. So what is the best source of information for trying to follow what's going on? It's tough. It's really hard. Imagine the difficulties, the complexity in identifying cases. But I look at a handful of sites. Honestly, I kind of just, really haven't looked much anymore. But the Johns Hopkins site, I'll put the link in here. That's just the classic site. People have been using this one for a while. I think the New York Times has a great site. And I just like the interactive nature of these things. And I'm just putting these in the Facebook threads. That's a good site. But there's a few others. I use this site. There's a timeline here that's really cool. Honestly, I limit what I go to. And then let's see here. I use the Detroit one as well, just for local news. Al Jazeera, believe it or not, has this really incredible timeline that they've maintained. It's really simple to follow, and it's global, which I like. So that's been useful. So, okay. Let's see here. Let's go to some other questions. Have a question on Zoom, so you guys can't see this. It says, my question is about merging low-risk bubbles. Our specific example is that my husband and I are 60, and he has additional risk factors. We have strictly isolated, and so have our son and his wife and 1-year-old. We are considering merging our bubbles so we can babysit and socialize with the little family. The baby won't tolerate us at 6 feet or with a mask. This seems pretty low risk to me. What do you think? So I agree at this stage, right? For most of it. I think the only issue I have with that scenario is what's happening to your son and daughter-in-law day to day. Are they going out and interacting with people? Are they in high-risk situations? Are they working in an office or a site that has many people together, right? That's concerning to me because they could certainly be asymptomatic carriers. Is the child, hopefully, they're not having to go to daycare so that, maybe you're watching them. So if you wanted to, you could put in the comments on Zoom here for the person that asked this question, what's going on with your son and daughter-in-law? What's their day-to-day like? Are they a teacher and they're in a classroom filled, with 30 kids? That's concerning for me. And then they're coming home. So hopefully that sheds some light on it. But if they truly could maintain low-risk environment, then I think it's fine. So they're working at home and seeing no friends except occasionally at 6 feet. So that was the response here. I think that is a very low-risk situation. There's lots of low risk to that. And I think you're probably, just know that there's not zero risk, but that sounds low risk to me, okay? You just have to have a real understanding with the people who are in that group, that bubble. Okay, let's see here. Any other questions that we have here that you guys want to answer? Specific places, you could post in the Facebook live feed of, breaking things out into low, medium, or high risk categories. The pool in our community closed down for the summer. I understand the decision. I think there are ways to manage this that it could have stayed open. I do believe that. There are things you could do. I think everyone understands that there's not zero risk in what we do. There's risk in being at home. as well. So whenever they made the decision, maybe it's not too late for them to think about ways to open up a pool, because what we're seeing is pools themselves are a relatively low risk place. It's just keeping kids apart in the pool that's going to be most important, keeping people apart around the pool. And if you could do that, that seems reasonable to me. That seems very reasonable to me. Okay, add your questions to the Facebook. I'm not seeing any others since the links that I posted. So if there are if there are comments that I'm not seeing, just let me know and direct me to those, because sometimes I just don't see, or my feed gets delayed a little here. But I think I've answered all of them so far. You guys gotta have more questions. I know you do. You guys always come up with really great questions. Because after this, I'm going out for a jog, like for a half hour, and it is hot. So any delay is valuable to me. Okay. Tara Perry, how you doing? What are your thoughts on elective surgery? So I've maintained, this is the same thing that I've maintained throughout all of these sessions. So first, assess on the necessity of the surgery. If it's something that could wait a couple years, let it wait. If it's not, and it's something that you really need to do, fine. Okay, now what's the next steps? Nothing changes, right? You want to make sure that wherever it is that you're getting this done has policies and processes in place. So I would ask them beforehand, what protective gear is everyone in the room going to be wearing? Will everyone in that room be wearing an N95 mask? Will everyone in that room be wearing a face shield? Okay, have they been trained on wearing N95 masks? Because surgeries are probably going to be an up close scenario, which innately is high risk. If the performers of the surgery are going to be protected, and you're even going to be protected potentially, then I think the risk overall is mitigated. Maybe this is an outpatient procedure on, let's say, someone's eyelid or something like that. I don't know. Where you're not under anesthesia, maybe it's just a local injection. You're going to have the ophthalmologist, let's say, pretty close to you, right over your face. So in those cases, I would ask and find out, are they going to be wearing full garb, right? They should be full protective gear so that they absolutely have a sealed N95 mask on. That is critically important. Okay, next question. Michelle Brown Schwartz. So if my husband and I and our kids have been in strict quarantine with no COVID issues, and my parents the same, can they hug my kids? So if you truly believe that you have been in strict quarantine, then I would say, and what that means is you haven't even gone to the grocery store for 2 weeks, you haven't been around anyone for 2 weeks, then yes, that should be a situation that should be safe for you to do, okay? The risk is still not zero because there's always cracks. The risk is not zero. But look, I think it's low enough that when you calculate the likelihoods, it's pretty darn low. And you get into the situation where there may be greater risks that we're not even thinking about in that situation, right? And so it's a personal decision, but if you've done everything to lower the risks, then I think, if it's important, then go for it. You have to learn to live you have to learn to live with COVID. Next question, and I'm going to ask you to provide a little more support on this one. Andrew Reese, do you think Big Pharma is integer? Just if you could shed some light on that, and I'm happy to comment. Randy, and if anyone ever needs a translator, Spanish to English, please reach out to Randy Pacheco Salazar. She is phenomenal. I believe you talked about this before, but where would we go to get tested to see if we already had COVID-19? So what Randy's speaking about is serological testing. Remember, diagnostic testing says, am I currently infected with COVID? It answers the question yes or no. Am I currently infected? Serology answers the question, have I previously been infected with COVID? I do not know the answer to that locally, Randy. I believe Beaumont Hospital is doing it. I believe urgent cares are doing it as well. Again, the caveat here is what test are they using? You want to make sure it has a high specificity and sensitivity, because you don't want to be told you are a carrier, you have antibodies when it's a false positive. That is very dangerous. So I think serological testing in high prevalence areas has shown to be pretty accurate, okay? So with the right test. So we definitely want that. John Ammo, yes, we are live right now, so feel free to ask a question. Okay, Celeste Ruggiero Gray, what are our feelings on the orthodontist? Do we leave our kids in braces for 2 extra years? This is, I think we could group this in the same category as Tara's question, in that I would find out what your orthodontist's office, what's their policy and systems? Are they in full protective gear that they could, right? What's their policy and practice? Full protective gear. Now remember, I think if you are a young and healthy family and it's your child who needs to go to the orthodontist, I think it's totally reasonable if everyone is ascribing to, if everyone has adopted the proper safety, that the risks are low enough, I'm willing to take them on something like getting braces off. I think that's totally legit, knowing that the people at greatest risk would be me, because I'm not really engaging in interacting with anyone who's at high risk right now. And that is a risk that I am personally willing to take because it's very low. And I believe that we approach greater risks out there. Now, these are all personal decisions, meaning there is no correct answer that I could provide or anyone could provide on this. I can only tell you what I would be willing to do and how I would preempt those decisions. In this case, it's finding out what are the policies and procedures of the dentist's office. I spoke to my dentist, and my dentist is taking full precautions. I mean, they're in full gear for every single patient that they're seeing. And you presume that they're cleaning the instruments and things like that, right? Like that should already be happening. Okay, Harriet Siegel Brown, if parents wearing N95 mask, is it medium to high risk if a young grandchild comes into house with 6 feet distancing? Do parents need to quarantine beforehand? So the risk is to the parents and grandparents, right? The risk is much lower the other way around, meaning to the kids. I think if grandparents are wearing a mask, if kids are wearing a mask, and you're 6 feet apart, and you've basically been quarantining or at least practicing good distancing, those risks are very low. They're not zero, they're very low. The more time you're together, the more time you're indoors together as well, those risks will just slightly increase, right? We've spoke about this. If you are local, meaning your family lives locally, meet them outside, if you can, and if you want to, catch a quick hug from them. I think the question that was posed earlier by Michelle Brown Schwartz, you could go back and listen to that one. Yeah, I think if you've been very vigilant about your physical distancing and you've been asymptomatic and your exposures have been minimal, steal a quick hug. Wear a mask as the adult, steal a quick hug. As a kid, they're going to put, their arms around your waist. I think it's a personal decision, of course, but I think you could get a hug out of that. And I think you could spend time with them. And the best way to do it is 6 feet apart, okay? These are all the same principles. Don't, there is no right answer here, okay? There's no bell ringing like, yes, go do this, don't do this. It's all taken together and understanding the risks. Okay, Tara, thanks, Adam. The surgery is being done at Children's Hospital, and they have policy similar to what you said. Yeah, I'm sure Children's has that, so that's good. John Amo, my mother is in retail outlets every day. She has asthma and one kidney. Should she be working in retail environments, or can I tell her that Dr. Rosh said to stay home? She's 75. So clearly, she is a very high risk individual, for sure. And when you have a high prevalence, high incidence environment, she is certainly at risk. And retail outlets, I'm taking it as those are stores that are indoors that have people coming in and out. She is at risk. That's as straightforward as I could get, and absolutely I would strongly recommend that she not be in that environment. I think if she must be in that environment, then she should be wearing a KN95 or an N95 mask. I think she should always maintain 6 feet distance from any other individual. That is really important here. So that's a tough one. Some people just have to do things. I mean, they will feel that there's other parts of their life that have more importance, whether it's putting food on the table or whatever it is. And so if you are going to put yourself in that situation, do everything you can to mitigate those risks. And that's the best you could ask. Okay. Randy, we finally saw Grandma and Grandpa. They came to our place. We received them in the backyard. We sat apart from each other. The kids hugged them, as you described, just a couple of times. We all wore masks, even the girls. I think that's the way we do it. I think that's it. Okay, we need to learn to live with COVID, but we need to be smart about how we do it. Okay. So Christine, good to see you. You could bring them to this video. So let's see here. John Ammo. Well, if she doesn't have to work, she shouldn't be working that environment at all. All right, so those were those great questions, guys. I don't know what happened. Bring them on. You guys just all of a sudden lit up with questions. Those are all really, really good questions. And to be honest with you, you incentivized me to think about kind of some behaviors and some things that I want to do now from this discussion. There's one question here. Is there any evidence that outcomes are improving at all in patients who are hospitalized with COVID? I can tell you this, that I believe, and I just glanced at the data, hospitalizations seem to be decreasing, but that doesn't really address outcomes. So I can't comment on that at all. I can tell you that every day brings more experience, for sure. Robin Schwartz, you guys ever need a PR in anywhere in the world, please look up Robin Schwartz PR. She's based out of Huntington Woods, Michigan. I use her for a lot of the work that I do. She's exceptional. So her question is, did you talk about how far we are from a vaccine or a treatment? I have in many episodes prior to this, even going back to probably episode 1 or 2, and my thoughts have not changed on that. I want to be proven wrong, and I will be glad to admit that I was wrong. I hope that's the case, but a vaccine is not saving us here. There probably will be a vaccine in the next 18 months. The likelihood of that vaccine being 100% effective is small, and therefore it will be helpful, but it is not the panacea here that some vaccines are. So I'm on the record for that, and I'm also on the record stating that I will be the first one to admit I was wrong. So I hope that that's the case. Okay, let's see here. I had no symptoms or others. So Christine, I wonder, were you able to get serological testing? I've spoken to a lot of friends in New York Cities and the hospitals there, and a lot haven't converted. But just, we have a long way to go, okay? This is really still the second or third inning here. And again, if you go back to all of our earlier episodes here, we've stated that we are going to feel like if we just get to summer, things are going to be better. This is a long haul, and we will be back in the chaotic environment that we felt in March and April. That will likely return to us again. So just keep that in mind. So thanks for sharing that post, Dana. I will take a look at that. It's in the comments for anyone. Okay, Michelle Brown Shorts, traveling to a different state to see people, family, friends outside at social distance. I think you want to do that. Like, if you want to travel, obviously risks start increasing because you're going to need to get fuel, you're going to need to get food, you need to get bathrooms. Just think about how you could do that in ways that lower risk. So if you need to get food on the road, go through a drive-through, eat in the car. I wouldn't eat in a restaurant. You need to urinate or do whatever you got to do on the road. You want to try and find a place that has the largest bathroom, the most aerated bathroom, right? You don't want to go to like a little gas station that has a tight bathroom. Maybe you go to one that has just a single bathroom at a time, and you wear a mask when you're in there. Or some of these highway ones are just huge. But remember, the more people, in my mind, the higher the risk. Anytime you're putting more people together, that increases the risk to me. Okay. Cool. So I'm gonna open this and I'm gonna pull this aside, this little letter here. Yeah, I mean, yeah, those look like good. Look, the issue with school, just so everyone knows, I mean, there is no way that that schools across any school will be able to create an environment that is riskless. I'm certain of that. No matter what, will be risks. A lot of these questions that I'm seeing on this sheet are excellent questions. And that is the discussion that everyone needs to be having, and everyone needs to answer those questions, right? Will you allow albuterol inhalers in school? There's no right or wrong answer to that. It's just that that question needs to be addressed so that there's a policy, so that people are informed and leadership is able to communicate to everyone what it is that they should expect. And then people can make informed decisions on whether they want to be in that setting with those particular risks, okay? That is a really good document there. You know, West Windsor was always the smarter school district than East Windsor, but who am I to say? All right. Let's see here. I work for James. Those questions are amazing. Yes. These are the questions, by the way, and I'm just glancing at like number 20. These are the questions that have been asked everywhere. But here they're being put into one place and being put forward. This is exactly the discussion that we've been talking about from day one that needs to be happening. These are the discussions that need to be happening in your community, in your workplace, in your school, in your gym, right? Every place. That is what you need to do for leadership, is communicate, communicate, and communicate. Over-communicate. And when you do that, you instill trust, you instill a process and a system, you build in redundancy and contingencies, and that's what creates the safest environment possible that we could work in. Okay. All right. All right, got a question from my dad. Let's see here. What should occur if you are sitting outside your home with friends within, someone needs to go to the bathroom? So this is a good one. So if someone needs to go from the outside into your house with a bathroom, this is a low risk behavior, okay? So if they have a mask, put on a mask. That is always number one. Put on a mask. Even if they don't have a mask, it's still low risk, but putting on a mask makes it even lower risk. Have them go to the bathroom, have them wash their hands. Remember, this is, the bathroom, the toilet should suck anything in as far as the virus goes. If they have a bowel movement or if they urinate, that should take care of any fecal oral transmission most likely. And that is, I think that's low risk. So I think you're fine to go to the bathroom. I think you're all right with that. Just be smart, right? Don't go inside and start talking to these people. Let them come back outside, okay? Totally reasonable. And one thing that I would also add to that, which I think is reasonable, is put a can of Lysol in your bathroom. This time it's not for the odor or scent. This time it truly is for sanitation. When they leave the bathroom, just ask them to spray it down. Just do that. A little quick spritz, and they should be, adds a little extra layer of protection. Fink, you finally got your pool open. I'm excited for you, and just maintain your 6 feet apart, okay? Just make sure you do that. Let's see here. All right, we got some great questions coming in, so feel free. Anything else, we'll stay on just a little longer. We've been doing this an hour, and happy to answer any other questions. I do think that everyone should go back. If you're just joining now, Dana Green posted a really wonderful PDF or Google Doc or Word doc that has very thoughtful questions that can be applied to many situations. And for anyone who's just joining us, circle back to the very beginning, go back to the beginning of this session. We talk a lot about specific activities and how you make decisions on risk levels for activities and whether to join them or not. Okay, we got some more questions here. Let's see here. Nope. Fly, Eagles, fly. Yeah, I'll tell you, I think COVID is going to give the Eagles a boost. The Philadelphia Eagles here. That's what I'm hoping. That's what I'm hoping to see. Okay. Anything else as far as questions go? Feel free to leave them now. Anything. If you're thinking of it, then other people are thinking of it. Let's see, Hightstown High School is doing in-person graduation after July 6th. The time doesn't matter, guys. Just so you know, whether you do it now or July really doesn't matter. Hopefully they just maintain their 6 feet apart. Andrew Reese, do you think Big Pharma is interested in exploring all forms of therapy? Naturally, it will take a long time before we see a vaccine. Maybe never, but maybe there are other avenues we should be exploring. As an example, it was brought to my attention that pharma may not be working hard enough on avenues of treatment or prevention when it doesn't pay them to do so. Certainly my own efforts to make sure that I'm covering my full spectrum of micronutrients. So there's a lot there. And, you know, I would say this, you know, there's a big pharma takes a lot of incoming as far as what they address and not address. And I'm not going to use this forum right now to really dive into that. But I could tell you that big pharma certainly has monetary incentives for sure. But I could also tell you that they take big risks and they produce many drugs for ailments and illnesses that are not huge money makers or, you know, highly prevalent in populations. And so I don't know what the right answer is for something like this. You know, I don't know where the line is here. And so, you know, the idea of vitamin, you know, some things like vitamin C have been always around. I think it was Linus Pauling. I think it was him who came up with these big doses of vitamin C as treatments for the common cold. And you know, it never worked there. So I don't know. But I'm going to give them the benefit of the doubt as far as coming up with treatments here. And a vaccine is not the only thing. But, you know, let me put things in perspective from the medical standpoint. The terrible consequences of COVID-19 is really, the majority of it is a respiratory distress syndrome, lungs filling the fluid. That is not new in medicine, in healthcare. We've been seeing that for you know, I mean, I've been seeing that for decades. And if I've been seeing it for decades, people have been probably seeing it for centuries and millennia. There have been tons of potential drugs being worked on for this, and none have been effective. There are just some things that we cannot solve at this moment. We do not have the insight and the ability to solve for them. Eventually we will, right? I believe in human ingenuity and science, and I think we will at some point. So I'll leave it at that. Okay. But I do think that the best thing we could be doing individually is to get in as good of health as possible. Cardiovascular health for sure. And then just mental health as well. Those things are really important. And so I'll leave it at that. Okay. Should 2-year-olds wear a mask when inside a house? Seems will be very difficult. It will be very, very difficult to keep a mask on a 2-year-old. You could try it. It can't hurt. You know, it depends on which setting. Why are they doing that, right? And I think we've addressed a lot of that here. So Dr. Flowers-Dotson, are you as concerned about the fall as much as I am? Sadly, people are tired and think we have done enough, hoping our medical minds are wrong. Well, I touch on this at the very beginning, at the first kind of quarter of this. The fact that, we've touched on this. I won't go into too much here, but it's actually the more cases decline and the faster pace they decline right now is much more concerning as far as how hard we're going to get slapped this next time around, probably. Okay, getting to summer was not kind of the solution or conclusion here. This is going to be this is the long haul. Okay. All right. Any other questions that you guys have? I see here we have a side conversation with some that I want. Maybe I think maybe I'll join and go to go for some drinks on the patio there. So, okay, feel free if you have any last thoughts for people who just recently joined. This was a really informational session. I encourage you to go back to the beginning and start from the beginning here in a minute. We'll also post this on YouTube. We talked about different risk levels for different activities, going to the pool, the beach, what that's like, some traveling, things like that. So we'll cut it there. Thank you, everyone. It's really great to see everyone. Please go back and watch. You're able to fast forward. There's a really great document that was posted in the comments as well that I urge you to look at. Dana Green posted. Otherwise, have a wonderful end of May, and we will talk again. Let me just check my calendar here. Okay, yep, we will talk on June 2nd. Excuse me. We will talk on June 2nd, and we'll have another session at that time. Thank you, everyone, and be well. Good seeing you.